I would like to welcome Dr. Shelena Lalji, who is an MD and functional medicine expert who will talk about comprehensive approach to ALS. Welcome, Shelena.
Um, I want to just take a moment to honor our heroes. You'll see several people you recognize on here. You'll see Indu's amazing husband, Peter. You'll see Ayaz, McFinn, Lou Gehrig. So many people that have paved the path for us to do this together and to make a difference together. And I think that's what it's all about. It's all about us working together and honoring our heroes. And that's my sweet darling husband, Ayaz, and we hope that one day all of you will be on top of the world like that, putting your arms out and saying, we did this together. So let's get started. We all know that ALS is a progressive neurodegenerative disease that affects 2 out of every 100,000 people each year. What's amazing is I feel that it is getting more and more and more common, and I am finding and meeting people with ALS almost every single day. And so we know it's becoming much more common than we used to think. We also know it attacks both the upper and lower motor neurons. And the point that I want to make here is, yes, it does rob slowly the body's ability to walk, to talk, to move, to breathe on its own, and eventually paralyzes and devastates all of those affected by it and their loved ones. But until they heal. And I want you to remember this during the presentation because we want to continue to have hope for each one of us that is listening and for all of the ones that are going to come after us. Every 90 minutes, we unfortunately lose somebody to ALS, and we need to make that stop. So we need to make this hopelessness and helplessness stop, and we're going to try to do this together. We're trying to take a three-tiered approach in all of this, right? So we're trying to focus on research. We know that the fight for a cure, this has been going on for well over 80 years, but it's just beginning to gain that momentum that we all want. And there's still a ways to go, but treatments are being tested daily. So I want you all to know that there are things you can be doing today. We don't have to stop and wait for things to get approved. We can do things today, and I'll talk to you about some of those things. We are all advocates, and I think the advocacy has to keep going. Everything ALS, and this is a shout out to Indu. I mean, just such an amazing job with advocacy. She started this in January, and here we are, and we have made such strides as a team, and Indu, awesome leadership. I also want to make a point that a lot of the things I speak about today is going to be targeted towards improving your day-to-day quality of life so that patients and family members are not resigned to just stand idly as their bodies betray them. We need to improve quality of life every single day. In order for us to truly understand ALS, we have to know that it falls into an umbrella of neurodegenerative diseases. And we have made bigger strides in some of the other conditions such as MS, such as Parkinson's, Huntington's, Alzheimer's. Lots of strides are being made in all of those fields. And what we have in common with all of them, and we need to learn from all the experiences from all of them, is that there are commonalities. There are things that occur in our bodies and in our gut-brain barrier and inflammation, and I'll talk about all this, that can lead to any one of these conditions or other chronic diseases, as well as things like cancers. So we have to know that the body, even though it's a very mysterious thing, it's also a very amazing thing, and it can heal so much. I want to say that we have learned a lot over time. This is a picture from an ALS Mastermind Summit that we hosted, our foundation, ALS Heroes, hosted last year, and we learned from people from all over the world. We brought in over 33 experts to come in and really discuss the root causes, the potential treatments, the protocols, what works in this country, what works in places like Germany, and we brought it all together, and we are learning, we keep learning. Our learning will never end, and we should always know that there's always something more to learn. So that is what makes us motivated and passionate to work together universally from all aspects and all corners of the world. Functional medicine is something that I've been really passionate about for the last 15 years. After practicing traditional medicine for 10 plus years, I thought to myself, there has got to be more that heals the body. What can we do to give the body the nutrients and the ammunition to be able to heal itself? Because it is an amazing and incredible thing. One of the fathers of functional medicine, Mark Hyman, a lot of people know him, basically said, and it's very simple, functional medicine is a medicine by cause, not by symptom. Functional medicine practitioners don't, in fact, treat diseases. We treat your body's ecosystem. We get rid of the bad stuff, put in the good stuff, and because your body is an intelligent system, it does the rest. And so let's dive in with that approach. When I speak about functional medicine, I also want to point out that we want to take an integrative approach. So it's not either traditional medicine or functional medicine. It is a combination approach where you look at both things together. So we want to identify, is it ALS? Once we've identified that, we want to investigate potential causes and triggers. We want to integrate history, lifestyle, testing. We want to restore and slow down the progression, and we want to start regenerating. So let's talk about what causes ALS, or what we think some of the contributing factors are of ALS. So the first thing that I'd like to dive into is the gut microbiome. It's very important. Can everybody see my presentation, my screen, as well
Yes.
as me in the corner? Is that what you're seeing?
Yes.
Okay, perfect. I just want to make sure the slides are visible. Okay. So we want to make sure that we start with the gut microbiome. In functional medicine, we always say all diseases, all conditions begin in the gut. Why do we say that? Because gut inflammation can translate into inflammation all over the body. And we know that the gut is like the brain. There are more neurotransmitters in the gut than there are in the brain. And so let that sink in for a second. The gut is where we need to really, really focus and start. And what I will say is I give kudos to institutions like Mass General, Merit, our sweet friend Merit. They're doing studies now on the gut microbiome and ALS. And why that makes me so happy is that we are not in two different fields anymore. We're not looking at ALS either from a traditional approach or from a functional medicine approach. It is a combined approach. It's an integrative approach. So you want to look at, do you have leaky gut? What is the permeability? We know that gut inflammation and the microbiome plays a huge role in many conditions, such as Crohn's, IBS, Parkinson's, and so on. We also strongly believe that it's very important in ALS. We know that there are bacteria that can secrete neuroprotective products like butyrate. Butyrate is a very important product. You'll hear more about it. We also know that it can secrete inflammatory products. It can secrete toxic substances like BMAA. You probably have heard on this very platform, one of our favorite people, Dr. Richard Bedlack, talk about the toxic substances that are being released and some of the studies that he's looking into as well. So the microbiome, it has been shown with 3 small studies that it is quite different in ALS patients, and it does indeed impact the rate of progression. So there's more studies to be done with that, but we know a lot about the gut. So we'll talk about that in just a few minutes. Some of the other potential causes, contributing factors. So when I say that, the reason I say it that way is because there is no single cause of ALS. We do know that. We know that there are so many contributing factors. And we also know that just about every ALS patient that you meet has unique areas, their progression, the way that it started, what triggered it, what is helping them, what is not helping them. They're very, very unique. It's not a one size fits all. So you really have to look at contributing factors that may be causes, but it could be different in everybody. You also want to look at, there's a huge autoimmune component. And I'll give a shout out to Dr. Stanley Appel on this because he's doing some great trials with T-Rex cells. You just heard from him a few weeks ago if you tuned in. You should also be considering parasites, mycotoxins, candida, which is yeast, which we know produce brain toxins. Lyme disease is another thing that does cause it in some people. Again, does everybody have Lyme who has ALS? Absolutely not. But can it contribute? Sure. Retroviruses, prions, there's great study being done at NIH with retroviruses, HERV-K virus by Dr. Nath. And so once again, we have a lot of amazing institutions looking into these things, but we know from a functional medicine perspective that those things are all important and they all cause havoc in our bodies. So what do we do about it? The diet is very important. Has this person been on a pro-inflammatory diet for years, decades? What kinds of toxins is this person exposed to? BMAA, I mentioned already. Heavy metals, think about mercury, think about lead, think about aluminum, and several others. Other things, other possible contributing factors, hormonal imbalance. Misfolded proteins, we know that there's a lot of work being done on that, as well as the TDP-43. We know that all of that creates debris and a toxic buildup in the brain. Oxidative stress that occurs in our bodies due to all the toxins in our environment and all the inflammatory processes. We know that the mitochondria is very important. That, if it's not functioning properly, can definitely trigger or cause different aspects of ALS. Physical trauma, which might cause some cervical stenosis, we see that across in a large number of ALS patients. Neuroinflammation, big one. Astrocytosis. And then I want to kind of talk about, there are components of spiritual, emotional traumas. You really need to peel the onion with those things as well. Exposure to EMF. We are surrounded by this 5G, everywhere. So exposure to EMF is also huge. And then the cell memorizes all that, the cellular memories of what's going on in our bodies. So those can be our potential contributing factors and causes. And now that we know that, we are going to start looking at what are we going to do about it. But before I get there, I want to, again, here's a big hope slide. ALS reversals exist. Dr. Richard Bedlack has identified 48, and you've got one on the call, on the moderator side of the call, McFinn. He has done such great work, Dr. Bedlack, because he's putting together these programs where he's actually studying the ALS reversals, and who knows, all of you could be an ALS reversal. And I hope that all of you are ALS reversals. But what we need to do at this point is we need to study them, we need to honor them, and we need to learn from them. So a shout out over here goes to McFinn and our sweet friend Mark Manchester and so many others. So now we know what may cause or contribute to ALS. How do we move forward from here? Where do we start? When I see an ALS patient, I always want to focus in on a comprehensive history. And this is very different than what we have been taught in medical school as far as the time that we allocate for our patients. Unfortunately, in the insurance world, there's not much time allocated, which is why I think it's very important for you to find physicians and practitioners who are able to really allocate time. And a lot of this does happen in the ALS multidisciplinary clinics as well, if you choose somebody that you can, work with. But when you look at functional medicine practitioners, we spend time to look at all of these things. The first thing I want to see is, what is your sleep pattern? Are you sleeping? Because I'll tell you, the only time your body is healing is when you're in deep sleep. That is the time that you're healing the most. What kind of stress level do you have? What kind of diet have you been eating? What kind of things have you been putting into your body? What is your lifestyle, movement, exercise? And then is there any mind, body, spirit work that's going on? Do you try to rest your mind, meditation, yoga, etc.? I say that and I tell you right away, one of the biggest sources of not being able to heal from any chronic illness, ALS included, is stress. Stress is breaking down everything in our bodies. And so it's very important to identify how much stress are you under and what are we doing about it? What are the sources and how can we eliminate it? Identify the emotional traumas, whether it's from childhood, whether it's from adulthood, what has happened that has taken a huge toll on you. Has it been grief? Has it been loss? Has it been whatever it is for you? Everything's different for everyone. Do you have a family history of ALS or other neurodegenerative diseases? As you all know, 10% of ALS is genetic and 90% is sporadic. But when you do have a family history of ALS, like my husband does have a family history of ALS, but he's C9orf negative. No genetic mutations that we really know of, except for one that maybe a correlation has been found. So we're investigating. So definitely look at genetic studies. Gut health symptoms. What's going on? Do you have any bloating, gassiness, constipation? All of those are signs that there is inflammation in your gut, that there may be leaky gut going on, which is very important because of the permeability and dysbiosis. So we have to look at, and this is a history that we always start with in functional medicine. We want to know what kind of exposure might our patient have had with parasites, viruses, Lyme, mold, and other such things, and also prescription drug assessment. You'll also find that a lot of ALS patients have physical traumas that may have occurred pretty recently before they got diagnosed. What does that have to do with this? Triggering of inflammation, most likely. Okay, so you do that, you make sure that whoever you're seeing, they do a comprehensive history and really get to know you as a person. Then you make sure that there's a detailed physical examination, a neurological examination, and of course, people best suited for a neurological examination is a wonderful neurologist that you can pick, functional neurologist, ALS multidisciplinary clinic, whatever you choose to do, make sure that a complete neurological exam has been done. Imaging studies have been done because there are different differential diagnoses that need to be ruled out before you're given the diagnosis of ALS. And I'll get to this in a second, I strongly believe in an extensive and customized laboratory evaluation. So we'll talk a little bit about what I'm going to recommend that you get evaluated on. And then, of course, customized therapies to stimulate full body healing and total regeneration is very important. So when you're looking at functional wellness, you kind of combine lifestyle, environment, and functional medicine. So you combine all of that, and that's what's going to give you true well-being. So where we like to start, where I've always liked to start with my neurodegenerative patients and specifically ALS is, like I said, I like to start with the gut. I like to identify if there is gut dysbiosis going on. There are some wonderful labs out there, some specialty labs, and I wish we could test everybody on this call and all ALS patients all across the world and see what gut bacteria they have in common, they have excessive, or they have deficiencies in. That would give us a lot of clues as far as how to move forward, and we have some plans to try to do that. Food sensitivities. You need to know that you're a unique person. So just because I may be sensitive to cauliflower or to red meat or to lamb or shrimp, what have you, that may not be your sensitivities. You need to know that you're a unique being, and so you need to look at what kinds of foods initiate inflammation in your body. So there are great labs. Two of the ones that I like to use for that are Alates, and there's a great lab called Genova that I use for a lot of different things. I like to look at Candida overgrowth. Yeast overgrowth is very toxic to our bodies. What that is telling you is a lot of the healthy bacteria, and we have billions of strains of bacteria, as you know, in our gut. When we take antibiotics chronically, when we don't eat the right food, when we overload on sugars in our diet, what happens is we are going to kill or suppress the healthy bacteria. And what's going to grow? Yeast and Candida is going to grow. So it's a growth and overgrowth of Candida that is going to, like I said before, can cause brain toxins. So you need to look at that. Also, A comprehensive stool profile, looking for parasites, looking for, again, really diving into the gut microbiome is very important. I like to look at inflammatory markers in my patients because you want to see what kind of inflammation is going on in their bodies. That can be done with a blood test. As well as just general screening. I like to look at, your hemoglobin hematocrit, your liver, your kidney, fasting lipid, fasting insulin, as well as fasting insulin is very important because when you're in a state of high insulin sensitivity, you're not going to be in a state to heal. We also look at uric acid because there's quite a bit of data that shows that uric acid needs to be in a certain range. We like to keep it between 7 and 8. And there are certain things like inosine that you can take to get it up there. And that tends to be protective. You also want to look at your endocrine system. The endocrine system is where all your hormones are. So there are different types of hormones. The first hormone I want to talk about is you want to look at your thyroid. The thyroid sits right here, as you know, in the neck. And most of you have had your thyroid checked by just doing a TSH and maybe a T4. That is not sufficient. You need to go deep, do a deep dive into thyroid, look at your TSH, free T3, I've got it listed right there, free T4, look at thyroid antibodies to see if you have autoimmune thyroiditis. If you have one autoimmune condition, chances are then there are other autoimmune components that might be leading or increasing the chances of what's going on with your body with ALS. And you want to look at reverse T3. So all of those are very important. And the scope of, really diving deep into the thyroid is beyond the scope of this presentation. But all that to say is you want to have optimal levels, not just within normal limits. And of course, we can talk about that in Q&A if anybody wants to know more. The next is you want to look at your adrenal hormones. Your adrenal hormones are your stress hormones. That's your cortisol. So the adrenal gland is in, where our kidneys are, right above our kidneys, and it produces cortisol. Cortisol is your stress hormone. It's going to be malfunctioning if you have too much stress over a long period of time. I see a lot of patients with adrenal fatigue and usually adrenal exhaustion when they have ALS because their bodies are just completely done and they cannot support them anymore. Sex hormones are very important as well. You want to make sure that if you're a female, your estradiol, progesterone, testosterone, DHEA are all within optimal ranges. And if you're a male, you want to make sure your testosterone, and you want to always make sure your practitioner is getting a free and total testosterone, DHEA, and also estrogen and progesterone are important in males and females both across the board. I like to also check neurotransmitter levels on my patients. So you're looking at your serotonin, norepinephrine, epinephrine, GABA, all of those are really important to make sure things are working the way they need to in your brain. So that's kind of, some of the testing that I do. And then you go deeper. And all of this, mind you, I'm giving you a comprehensive approach because I like to take a look at your entire biochemistry so that we can see what may have caused, contributed to, or triggered your ALS. And we can't know that because we don't have just one single cause unless we take a deep dive in it. Nutritional deficiencies is very important because all of us are exposed to, unfortunately, chemicals and pesticides in the food, and we don't get the nutrients. Even if you eat all organic, you're not going to get the same nutrients that our ancestors did perhaps 50 or 100 years ago. So that is a very important thing to look at. You want to look at what are the oxidative stress markers that you might have in your body. How is your energy and mitochondrial metabolites? What are your organic acids showing? And what about the essential fatty acids? What is going on with those? And that's going to be important once I talk about one of the treatments. So I've listed some of the labs that I like to use for that. I like to look at toxin levels in my patients, whether it be heavy metals or other toxin exposure that they might have had, including Lyme or other viruses and mycotoxins. So when you look at mycotoxins, there's two labs that I like to use, Great Plains and Real-Time Laboratories, and both of them have their pros and cons, and sometimes you do both depending on how much we suspect mold is a part of this person's existence. And then, of course, the viruses are important to look at. Like I mentioned, retroviruses are being looked at very in detail with at NIH with the F.A.C.O.G with Dr. Knapp. And I just gave you a ton of information, so I'm sure your brain is just flipping around and you're saying, oh my God, what am I going to do now? What do I do with all of this information? Well, let me try to simplify things for you. Remember that when you're trying to address ALS, it's like treating a forest fire. It is burning the trees down at such a rapid pace, and your trees are like your motor neurons. It is a forest fire. First of all, you got to find that fire. What was causing that fire? Find it. Find the root cause of that fire in you, not in the next person with ALS, but in you. We need to stop that fire, and then we need to start rebuilding this beautiful forest, which is our body. I want to share a quote with you by one of my favorite poets, Rumi, and he says, where there is ruin, there is hope for a treasure. So remember that. You have to keep going. So how are we going to stop this fire? First of all, we're trying to find the fire. We talked about that. We talked about the multitudes of tests that you may want to consider having if you haven't had them already. How are we going to stop the fire? First and foremost, you don't want to keep feeding the fire, so you get rid of the toxins. What kinds of toxins am I talking about? Environmental toxins. We're exposed to that. It's everywhere. It's all around us. You want to start using non-toxic cleaning products, non-toxic personal products, eliminate pesticides in your home, garden, lawns, incorporate some non-toxic organic products in your surroundings. And check your home for mold if you can. If you suspect mold, check your home for mold. If it's present, you got to get away from it because you're continually exposing your body and it's going into this phase of inflammation and your immune system is overreacting and it's trying to fight all of this off and it's leaving no time to heal. All it's doing is giving you time to just spiral downwards, and we don't want that. You also may want to consider what's happening in your mouth, in your oral cavity. So when you look into your oral cavity tonight, when you're brushing your teeth, make sure to see if you have any mercury fillings, any amalgams, and consider getting those out. This is a theory. This is a very strong theory, but look at your mouth and try to find yourself a biologic dentist to get rid of that and to get rid of cavitations. Again, I could do an hour discussion on this, but it's beyond the scope of this presentation. The other thing you want to do is detoxify your body. So get rid of the toxins, make sure your environment is clean. And one other thing I want to mention when you're cleaning your environment, EMF. Turn off those cell phones. Turn off that Wi-Fi. Try to turn it off at night, at least while you're sleeping. You don't need the Wi-Fi at night while you're sleeping. Turn it off. Put the phone away from you. You've heard these things before, but take it seriously because that EMF is causing havoc because that is something that our bodies do not like. Our bodies don't like all of that radiation coming at us, and so that's very important to cut out that EMF. Now, what are some ways you can detoxify? I always like to start my patients with a mild, not severe, not harsh, because already an ALS patient is going through a lot in their body, but a mild 14-day detox that I like to start all of my patients with, unless there is a concern with them. So again, customization and really just focusing in on what's unique about the patient. And in that, I like to eliminate all inflammatory foods. So I like to eliminate gluten, sugars, dairy, but maintain the calories. You're getting the calories from high, healthy fats, from good protein, from really good fruits and vegetables. You're going to need to get your calories because ALS patients, as we all know, do not need to lose weight. Okay, so make sure that you're but you don't need the bad calories. You don't need the inflammatory foods. Some of the ones that I just mentioned and others, your physicians will tell you if they do the food sensitivity test, what you may or may not be sensitive to. So again, a customized, rotational, healthy eating program that brings in healing foods. A lot of you may have used or can use, and if you can, please do, infrared sauna and hyperthermia modalities to sweat things out. Sweat out the toxins as much as you can. Light therapies, hand detox, foot detox, other detoxification supplements such as chlorella, zeobind, glutathione. And I love this one. This is something that is super easy to do, castor oil packs. They work really well to really focus in on the detoxification of the liver, the gut, the kidneys, all of it. So we talked about this, and we talked about treating the gut. After the 14-day detox, we want to make sure that my ALS patients, I have to make sure that they're emptying every day. Why is that important? Especially for ALS patients where they might be in wheelchairs, or they might be in situations where it's just so difficult. The entire bowel routine is so difficult. But I'm here to tell you it's very important, because whatever is not out is in, and that needs to be out. Your toxic waste needs to be out. So try very hard to empty every day, and there's, of course, things that you can do to make that happen, and we can talk about all that stuff if need be. Treat the parasites and candida if present. Treat candida if present, okay? Herbs are very good at treating candida, and other supplements like oil of oregano, caprylic acid, apple cider vinegar. All of those are amazing to treat candida and to lower the yeast load in your body. But of course, it's very important not to feed the candida with sugars. So sugars got to be out, and other inflammatory foods need to be out. Artificial colors, sweeteners, got to be out. Introduce healing foods, foods that are going to be high in probiotics, prebiotics, and make sure you're getting supplements like digestive enzymes, protease, proteolytic enzymes, and I'll go over the supplements in a few minutes. The other thing to stop the fire, like I mentioned before, we all have it. We all have emotional and psychological stress. Some of us more than others. I mean, imagine we've had ALS in our family for 3 years, being a caregiver, being a provider, being a mother, being an advocate, being a researcher, and I'm here to share with you. Also, I'm a breast cancer survivor. Last year, about this time, actually exactly today, just occurred to me, October 7th, 2019, was when we found the lump in my breast. And I need you all to know that whether you're the patient or the caregiver, you need to take care of yourself, because the stress is real. If you're an ALS patient, if you have emotional traumas, emotional, psychological wounds from whenever, you've got to deal with it. The best ways to deal with it is things like cognitive behavioral therapy, neurofeedback, heart rate variability. Best way, meditation and mindfulness. You don't have to pay a dime for that, and you can do this for hours. But if you can't do it for hours, do it for 10 to 30 minutes a day. It's going to change your life. Make sure that you have practices of gratitude in your life. Wherever you are on the ALS journey, or if you're a caregiver or a practitioner, there is something to be grateful for. Be grateful you're still here today. Be grateful that all of us are working on trying to find a cure for you. Be grateful you're surrounded by loved ones, family, friends who are in this fight with you. Gratitude. Start your day off with literally write down 10 things you're grateful for every day. Your mind will just completely shift. Your energetic field will completely shift, and your body will go into a state of healing just with that gratitude. There is a ton of research on this. This is not hokey science, ton of research on energetic fields and how it helps you heal your body. I'd like to share some of my favorite apps that I use personally, that my husband Ayaz uses, my kids use. One is called Calm. It's one of my favorites for meditation. Insight Timer is a great one. And yoga, if you're able to do yoga. And even if you have ALS, and even if you're in a wheelchair, there's chair yoga. Try to practice yoga. Down Dog is an amazing app for that. I'd like to just really, really emphasize, we know this since 400 BC. We have an amazing scientist that left us with this information. It's the Hippocratic Oath that all of us take. And it's from that person: let food be thy medicine, and medicine be thy food. Be sure you know what you're putting in your bodies. Even if you're unable to eat, you are able to perhaps drink smoothies. If you're not able to drink smoothies and if you have a PEG tube, you're able to distinguish what you're going to put in that PEG tube. Everything that is going to be healing. So let food be thy medicine. The other thing that's very important to rebuild this forest, rebuild our body, is to make sure that nutritionally we're strong and balanced. When you do a test to see which nutritional deficiencies you have, and I feel pretty strongly about this because I've done this for the last 15 years in my patients. I always tell my patients I don't want to shoot arrows in the dark. I want to know what your deficiencies are and be able to correct those deficiencies, because nobody wants to be on 40 different supplements a day. So let's see where your deficiencies are. Certainly for ALS, there's some foundational supplements that you should be on. But other than that, you need to know where your body is deficient. So you want to replace with medical grade supplements, with antioxidants, things to support your mitochondria, things to give you the healthy fats, the MCT oils, things to really balance your minerals, your electrolytes, things to boost your brain function with the brain vitamins and minerals, and to reduce stress. Some of the greatest stress reducing supplements are things like GABA, lithium orotate, L-theanine, even CBD oil. So when you're trying to rebuild the forest, you can do so by doing all of the things that I'm mentioning. If you are fortunate and if you want to approach this from a more aggressive way, and you want to consider that some people who have gut inflammation, you can put tons of supplements into their body, but if they have leaky gut or gut dysbiosis, there's going to be only a very small fraction of things that they can absorb, which is where IV nutritional support has come into play over the last several decades. I'm sure most of you have heard of this. In my practice, we've done this for over 10 years, where we've done IV nutritional support with things like the Myers IV, which has vitamin C, B vitamins, magnesium, IV vitamin C, which we're doing a ton of because of immune support. We all know how good vitamin C is for the immune system. Imagine taking 20 grams of vitamin C, or even 5 grams of vitamin C, straight into your vein rather than taking it in by mouth, and you're only absorbing 10 to 15% of it. That is 100% absorption, so think about that. And for ALS patients, you want to make sure that you're keeping your immune system up, especially during these times of a pandemic. You don't want to get sick because your immune system is most likely already compromised. So think about making sure that whatever you need to do, whether it's food, whether it's supplements, whether it's IVs, you need to support your immune system. IV glutathione, I mentioned before, is an amazing antioxidant, one of the best that we know of. A lot of you and a lot of my ALS patients ask me about the PK protocol. Yes, that is something that's there, and there's research behind it. And specifically, it's not necessarily you have to do the whole protocol. What it is the agents that we're putting into your body. It's butyrate, it's phosphatidylcholine. These are items, these are supplements, these are products that actually build your cells. They rebuild the cells, they clean up the cells from within, and they work on the fatty acids that are part of our bodies and that are integral part of our cell membranes. If you have metals in your body, you could consider oral or IV chelation, and there's other IVs such as UV light treatment. Now, I want to make sure that everybody understands. This is not something you have to do. This is not something I'm saying that you should do. All I'm here to say to you is, in the field of integrative medicine, these are things that are out there. You have to know what is right for you. You have to customize your approach, because it's very important to know what is happening in your body and where your needs are. This may not be something that you need to do at all, but this may be something that might help you a ton. So it just depends on where you are. These are all things that we have done for my husband. And it has helped him tremendously because, and I didn't mention this in the beginning of our conversation, but because his progression was so incredibly rapid, we were told by a very well-renowned institution that he would have about 6 to 9 months. And this was in November of 2017. So we are at 3 years by the grace of God, as well as his tenacity and his strength. Nothing happens without the strength and tenacity and belief of the ALS patient themselves, as well as a lot of the procedures, treatments, protocols that we have employed and we have had the good fortune of being able to do because of what I knew and the networks that I had to be able to do this. That's all to say that those were our blessings. And from those blessings, I'm here today trying to share this information. But please don't take me wrong and think that you have to do these things, because yes, it gets expensive and you don't have to do these things. But if you want to do it the right way, under the right supervision, and for the right reason. So in rebuilding the forest, you want to also make sure that your endocrine abnormalities are corrected. I spoke about this with thyroid optimization, bioidentical hormones for the sex hormones, adrenal rebuilding to get the cortisol working better, the adrenal glands working better. And then, of course, there's cell regeneration with stem cells. There are a lot of stem cells out there. You hear about them every day. And I'm going to share with you what I truly believe. I truly believe the Neurone trial has a lot of promise, and I'm very excited to see it come to an end and to have all of that available to every ALS patient that would like to take part in it. When you hear of stem cells, whether it be MSCs, bone marrow stem cells, whether it be other forms like exosomes, whether it be umbilical cord plasma stem cells, whether it be, any of those stem cells that you hear of them all the time, everywhere. Please don't think that that is a miracle cure, B, it's going to all of a sudden take away your ALS, C, that you must jump and get it into your body as soon as possible. In fact, please don't engage in any of that until you have really focused in on clearing your body of all of this toxin, feeding your body the right things, getting your body nourished, getting your body to a point where you can handle certain procedures that you might be looking at. You've got to strengthen your body first. Detoxify your body first. Yes, there is an amazing amount of work being done in the stem cell world, in the regenerative medicine world. There is amazing work with microglia and astrocytes and incredible things happening. And hopefully that's not far away. In the meantime, until we know more, be sure that you're not engaging in things just because somebody told you about it and you're desperate and you go look for the next best thing at the next best clinic. Be aware of what is out there, do your research, and only make those decisions with all the information necessary. I want to make sure that everybody understands that movement is very important, whether it's exercise, range of motion, because we all know ALS patients have a lot of spasticity, a lot of muscle fatigue, as well as a lot of stiffness and hyperreflexia. We make sure that my husband Ayaz gets range of motion exercises at least 3 to 4 times a day. We're massaging him quite a bit. We're making sure that the blood flow is going, the lymphatic drainage is happening, and things are just moving. Even if you can't move, you need some passive range of motion because you do not want contractures and you do not want to have that pain that comes with the spasticity. So very, very important to do a lot of range of motion exercises and different kinds of exercises, different therapies, whether it's physical, occupational, respiratory, speech, all of that is very important. Massaging, I just mentioned that. Massaging with extra virgin coconut oil, very, very good for the entire body to release a lot of the toxins as well as to just make sure that the muscles are not stiff as they are. This is a very important one. Employ and engage with your friends and your family. This is so healing and so important. You do not want to isolate yourself. You may not recognize yourself because you may not be running marathons anymore, or you may not be doing the kind of work you used to do. they recognize you. They recognize the inner you, and you have to focus on the inner you. Your friends and family, the ones that are really there for the entire journey, are there because they love you. So take advantage of that. It is very important that you take advantage of being surrounded by positive energy. Only surround yourself with people who know that you can do this. You can fight the good fight, and you can have awesome quality of life despite your limitations, because your brain is there, your body is still there, your heart is there. So be sure you surround yourself with that emotional well-being. It is also important that a lot of ALS patients, we know this, it takes over $250,000 a year to take care of an ALS patient. It's a lot of money. It's a lot of financial distress. Share that. Ask for help wherever your help is needed. Establish a good, strong team of physicians, medical team members, therapists, your community, your friends, your family, because you want to try to get to the best quality of life possible. Here's a slide that a lot of you might have been waiting for. This is not a complete list, but it's a pretty long list of supplements that a lot of different people have used, especially a lot of the reversals, and they make sense. But that's not to say, and again, caveat here, please don't run to the, run online and buy all these supplements. These are not here for you to think that you need to be on all of them. But I want to go over the supplements because there's a reason why your body needs a lot of this, and it's important for you to know what you need. Once again, functional medicine is all about customization. So I want to highlight a couple of things on this screen. One is TUDCA. A lot of you have heard of TUDCA. We've had some talks in which Dr. Merritt has also spoken about the trial that she's doing on TUDCA and phenylbutyrate. It's an awesome, awesome supplement, and it's great because it's going to help. It's a hydrophilic bile acid. And what it's going to do is it's cytoprotective, and it's really good for anti-apoptosis. And it also has a lot of potential for neuroprotection. So TUDCA is something that's being studied, that it's being studied at Mass General. And so something that I would strongly suggest that you get on TUDCA and sodium phenylbutyrate. Theracurmin by Integrative Therapeutics, an awesome type of curcumin. I would go with that because we know Dr. Bedlack is studying it. He's looked into it deeply. We all know curcumin is amazing. If you can, try to start on that, one BID at least. Now, there's other things, many other things on this screen. Probiotics, I feel very, very strongly about. You need to keep your gut healthy. Digestive enzymes, I feel very strongly about. If you have a lot of stress, then you might want to consider GABA and L-theanine. I like a liposomal form of that because it's absorbed better. NAD is a fantastic supplement to support the mitochondria. There's also been research on NAD and neurodegenerative diseases. A lot of you might have heard of products called LeapXX, L-serine. L-serine is really a great supplement because it's been shown to work and decrease the BMAA toxin, which there's a lot of studies in which we talk about BMAA levels being very high in ALS patients. You must make sure your vitamin D levels are optimal, not just adequate. So when you're checking your vitamin D levels, the range is 30 to 100. You need to be close to 80. So remember that number, jot it down if you want to. There's other supplements on there. If you have depression, if you can't sleep, there are things that you can do for those types of things that are very important. And you can do things naturally and start naturally. And if you need to do other things that are not natural and pharmaceutical, that's where integrative medicine comes in, where it doesn't have to be 100% natural. If you need it, then you have to consult with a physician and perhaps consider it. Other things that you can consider, if you can't get to a wellness center where they do IV phosphatidylcholine or IV vitamin C or IV butyrate or IV glutathione, I would advise that you do liposomal forms, because liposomal forms of glutathione, vitamin C, it is absorbed a whole lot better than just taking a capsule or taking a pill. So look into that. Look into doing MCT oil with butyrate. That's what I give to my ALS patients because, again, we know butyrate. There's some secret sauce with butyrate because we know that it does differ with ALS patients versus control subjects. We've talked about the IVs a little bit earlier, so I'll skip through that. If some of you can, there's a lot of research that's been done on methylcobalamin, high doses of methylcobalamin injections 2 to 3 times a week. And then, of course, you want to measure your B12 levels as well. There are other things that are under study, such as peptides. There's a lot of work being done on peptides. Once again, what I'm going to say is don't just run to the closest clinic that might be doing peptides and start doing a ton of peptides. Everything has to be well researched. Everything has to work for your body. Everything has to be looked into very carefully. I know from personal experience, and you know I know this from personal experience because of my husband having ALS. And we made these mistakes, and I promise you, when I tell you something, I'm not just telling you my successes. I want you to learn from my mistakes as well. When you get diagnosed with ALS, you feel like your world has just gone upside down and the ground beneath you has just slipped away. And you want to do everything, and you want to do everything yesterday. I caution you, don't do that because you are going to overburden your body. Don't start with 20 supplements right at once. Don't start with all this IV therapy. Don't start with stem cells. Don't start with peptides right away. Clean up your body. Take a moment. Take a deep breath. And know that where you are is where you're meant to be. We don't know why. And I know some people might hate me for saying this, but I say this as an ALS caregiver. I say this as an ALS wife. It's a tough journey, but it's a journey that we're all walking together. So when you're walking this journey together, stay calm. Stay calm because if you're in a flight or fight mode, and if your body is in a sympathetic state constantly, in a state of panic, you won't be able to heal. I don't care if you take 40 supplements and do every IV that I've mentioned and do every stem cell procedure out there. If your body is in a state of panic and a state of sympathetic, which is a fight or flight mode, I'm here to tell you the body can't heal. The body needs to be in a state of calm and a state of rest and a state of peace. It's what we call the parasympathetic state to be able to absorb, integrate, heal, regenerate. And that's very, very important. A lot of this I've mentioned at some point or another. We've talked about massage, we've talked about exercise, acupuncture. If you're having pain, acupuncture is a fantastic fine art, Chinese medicine, lymphatic drainage because you're getting sore and you're getting all of this lack of movement, and so you're getting all the toxins built up. Lymphatic drainage is very important. Different kinds of neurorehabilitation is important. And once again, and I cannot mention this enough times, make sure you're sleeping, whatever it takes. The first thing you want to do, and I know a lot of ALS patients, and I treat a lot of ALS patients, what I see as a common thread is poor sleep hygiene leading up to their ALS diagnosis, for whatever reason. Make sure you're sleeping. You must try to get 8 to 9 hours of sleep, and you must try to get into deep sleep to heal. Definitely employ some forms of energetic healing protocols. Definitely. Mindfulness daily, gratitude daily, meditation daily. There's some great things that we've employed as a family. Love Joe Dispenza's You Are the Placebo. Watch those. Listen to the book. Read the book. He has a great 9-week progressive course that allows you to release all of your emotional trauma. Bruce Lipton's Biology of Belief, one of my favorite reads. Release whatever you're holding on to emotionally. Again, remember, a state of calm is a state of healing. A state of panic is a state of disease. Please remember that, and try to institute in your body, in your mind, just complete calm as much as you can. Listen, ALS is one of the toughest, no, not one of the toughest, I take that back. I feel it is the toughest disease I know. I'm a breast cancer survivor. Cancer was hard. Cancer is very hard, but cancer in me, I feel like ALS is so much harder for me and my family right now. So I get where you're coming from, but please focus on healing yourself energetically, mind, body, spirit. Listen, there's a ton of studies out there. We are going to find a cure. I have no doubt in my mind we are going to find a cure. It's just a matter of when. Cure is out there. We're working hard, and I've never seen this much movement and this much excitement in the world of ALS ever, ever. This is, if there was a time to have ALS, it wasn't 50 years ago. It's now, because the cure is coming up. We just need to hang in there. We need to hold each other, and we need to start healing and enjoying this day of our life, no matter where we are in life. So I want to kind of end some of my thoughts by mentioning the quality of life is very important. It's very important for you to realize no matter what stage of ALS you're in, whether you were just diagnosed, whether you're in early stages, you can still walk and talk and eat, but you're just feeling some weakness, or you're in very late stages where you are not able to walk, talk, swallow, eat, hug your loved ones, or even breathe on your own without assistance. Whatever stage you're in, try and have fun. Try and relax. Try and laugh if you still can. Try and smile. Try and do experiences with your family that fill your heart and fill your soul, because who knows which one of us is going first? We don't know who's here tomorrow. We don't know what life is going to bring us. Could we have ever imagined this pandemic? We don't know what tomorrow holds. Have that peace and quiet and calm and joy and gratitude today. Use healing supplements, whichever ones of your choosing, to heal your body, to energize your body. Make sure you're sleeping. Make sure you're resting. Make sure that you're honoring your purpose on this world now. Make sure you think about that, feel into that, dig into it. Don't wait until you're better. Don't say that, when I'm cured of ALS, I will do X, Y, and Z. Do it today. Do it now. Have those experiences now. I tell my husband, let's live now, because we're all working very hard for each one of you. We just dropped off our daughter Zoe to college, to UT Austin, and my husband, in his wheelchair and all, came with us, and we did that 3-hour drive, and we stayed in a very safe place, and he wanted to be there. He wanted to experience that now, today. And when you can use technology, as Steve Gleason says, most of what ALS takes away, technology can give back. Use any and all technology that you can get to improve your quality of life. I put this screen up because, of course, we're all proud of our children. I'm very proud of my children, Zoe and Zade. Some of the, if you're wondering what recipes to use for your tube feed or for your smoothies, if you go on ALS Heroes, my son Zade has done all of those recipes, and he's an amazing mind with nutrition, and he's only, get this, 17 in 3 days. He's turning 17. And my daughter Zoe, this was a TED Talk that she did. Both of the kids, just like I'm sure yours, are incredible, amazing human beings. We as a family, we feel like we as a family have ALS, and we as a family are trying to do something about this. I would be remiss if I didn't give a message to caregivers. Caregivers like me and my kids out there, I want to tell you, caregiver fatigue is a real thing. If you're feeling it, you need to admit that you're feeling it. You need to be kind to yourself. You need to nurture yourself. That's what your loved one wants. Your loved one with ALS wants you to be healthy. They want you to be well. They want you to be taken care of. They want you to be there for them, because if you're not well, you cannot care for your loved one. So sleep. When they sleep, you sleep. Rest. You meditate also. You exercise also. Eat healthy also. This is not just about how do I keep him or her healthy and it doesn't matter what happens to me. I already told you what happened to me. Don't neglect yourself. My husband is the first one that tells me, honey, go do something for yourself. Go get a massage. Go do something, because he wants me to be healthy. We know what not taking care of yourself does. So take time to recharge and rejuvenate yourself. I want to end with this quote, because ALS can be a deep wound. It is a deep wound. But behind every of the deepest wounds is the doorway to the greatest gift. Bless you all. We are all here with you. And thank you to all of our heroes that have been down this journey before us, that are traveling with us, and that will come after us. Thank you so much.
We're really honored to have you here and everything. She is my hero, by the way. And, you know, she is a awesome mom, you know, a caregiver and a wife. And she works around the clock to keep everybody going. As she said, she's a breast cancer survivor as well. And we're honored to have her here. And also today, I would like to introduce as our, you know, you have a lot of questions and we've taken down all those questions here. And we're going into go into Q&A now. And actually the two people who are amazing, who are going to be moderating your chat is Sarah Diaz. And you probably met her before. Sarah is a medical student. She's also a registered nurse. And she joined us in honor of her father, who passed away 2 years ago to ALS. And in his honor, she's going back to medical school and to learn more about it. And Zoe, who is actually Shelena's daughter, and you've seen her as well in many of our talks before. And she is a freshman at UT Austin. And I welcome both of them to take us to the next part of our session today.
There you go.
Hello. Good to see you.
You're in the dormitory, I guess.
I see you're in your dorm.
Yeah, I'm broadcasting from my dorm at UT Austin.
Awesome.
As Indu mentioned, the great Dr. Shel is in fact my mother. Talk about some big shoes to fill, am I right?
You're amazing. That's all I have to say. So,
of course you
and
say
I just want to say, Indu, you are my hero. Before I answer any questions, Indu brings tears to my eyes, because what she has been able to do is just nothing short of incredible. And I don't know really anybody who could have accomplished what Indu has accomplished for the ALS world in such a short period of time. So Indu, to you and Peter Cohen, you know, if I had a glass of something to cheers, here's cheers to both of you.
Thank you. Thank you. That means a lot.
Yeah, I second that. So before I go into the questions, I just want to say that, as my mom mentioned, it is the anniversary of her cancer journey. And I just want to say how proud I am of her and how strong she's been, you know, and it's incredible how much life has thrown her way and how she has been able to persevere through anything and everything and still be the powerhouse that she is and still help all ALS patients and just be so positive and so hopeful. And she's my inspiration. And with that, I will start with your questions, because there is a ton of questions.
Great.
Okay, so the first question is, after the initial diagnosis, what do you feel are the most important tests that ALS patients should get? And can these tests be performed at home with traveling being so difficult?
That's an excellent question. And, you know, I reviewed a lot of labs, and where I think it's important to start, and we've had to do this recently. We've had to pivot in the medical field where most doctors are now doing telemedicine. And we have had to find ways of taking care of our patients via telemedicine. So if you are wanting to start on your ALS journey with what should I test and what should I do, like I say that, you know, you definitely want the basics, right? You want